Hey everyone, I'm Dr. Michael Breus, the sleep doctor. If you're someone who snores, chances are you've wondered if there's a way to make that classic sound go away, especially if you share the bed with a partner. Well, good news, I've got some ideas. But first, why do we snore anyway? When we sleep, tissues in the back of our throat relax. That narrows the airway so that each breath is now being pushed through a smaller space. As the air rushes past these collapsed tissues, it causes them to vibrate, and these vibrations are the raspy, wheezy sound we call snoring. So that's the mechanics behind it, but there are many reasons why some people sleep quietly and others don't. Anything that contributes to the narrowing of the airway is going to increase the chances of snoring. That includes nasal congestion, extra weight around the neck, and problems with the anatomy of your nose, mouth, or throat. Drinking, smoking, your weight, and other lifestyle choices can also factor in. Plus, some people are just more prone to snoring, including those who are pregnant or postmenopausal, older adults, as well as men and those assigned male at birth. Now, snoring can be anything from a minor inconvenience to a more serious condition that requires medical treatment. If your snoring is mild or infrequent, it can probably be reduced or eliminated with home care. Number 1, try changing your sleep position. People who sleep on their back tend to snore the most. Side sleepers snore less often. You might also use a pillow to elevate your head and neck. Number 2, avoid alcohol before bed, which can further relax the tissues in the airway and lead to increased snoring. Number 3, address nasal congestion. Congestion prevents the free flow of air. Using nasal sprays, antihistamines, or saline irrigators may help you breathe easier. I always tell people that they need to decongest for better rest. Number 4, maintain a healthy weight. Snoring is closely linked to excess body weight. Keeping extra pounds off helps relieve pressure on the airway. And number 5, practice good sleep hygiene. There's some evidence of a connection between daily routines that encourage restful sleep and less snoring. Try going to bed at the same time every day, avoid electronics before sleeping, get plenty of exercise, and keep your room as dark as possible. Okay, so far, so good. But as I mentioned earlier, sometimes snoring can indicate a more serious condition. Indeed, snoring is a common symptom of a disorder called obstructive sleep apnea, or OSA. In people with OSA, the airway repeatedly collapses throughout the night and interrupts breathing. This is often followed by gasping or choking. If you or your bed partner notice these signs, be sure to tell your healthcare provider. They can work with you to develop an individualized treatment plan. The plan might include some of the home care we've already talked about, but your doctor may also prescribe you a medical device designed to treat apnea. One of these is called a continuous positive airway pressure machine, or CPAP for short. A CPAP machine prevents a person's airway from collapsing by pumping pressurized air through a tube into a mask that covers either the nose or the nose and mouth. CPAP machines are considered one of the more effective treatments for individuals with sleep apnea. According to the research, with regular use of a CPAP machine, most people experience a major reduction in apnea symptoms. Alternatively, your doctor may prescribe an anti-snoring mouthpiece. These are worn at night and are designed to keep the airway open. Anti-snoring mouthpieces come in 2 types. Mandibular advancement devices push the lower jaw and tongue forward, keeping them propped away from the airway, while tongue retaining devices focus on drawing the tongue away from the airway using suction. It's worth noting here that while studies suggest mouthpieces can help snorers with and without sleep apnea, around 1/3 of people are unable to use them, often because of discomfort. So it's important to have your mouthpiece fitted by a specially trained dentist who understands your diagnosis and treatment plan. Another option to consider if you don't have apnea are nasal dilators. These come in 2 varieties: external, which is just a strip that goes across your nose, and internal, which is a small device that goes inside your nostrils. Finally, some people require surgery or inpatient procedures to stop their snoring. This is usually due to structural problems that end up blocking the airway, like large tonsils, nasal polyps, or a deviated septum. If you'd like a more personalized look at how to stop snoring, take the snoring quiz at thesleepdoctor.com. And remember, it's always a good idea to discuss your specific sleep concerns with a medical professional. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.